Upbeat background music plays. The host stands in front of a medical backdrop with a screen displaying COMPASS trial, Rivaroxaban+Aspirin. Welcome back to our channel. Today, we're exploring the COMPASS trial to answer an important clinical question. In patients with stable atherosclerotic disease, is Rivaroxaban+Aspirin more effective than aspirin alone in reducing cardiovascular death, stroke, or non-fatal myocardial infarction? Let's get into it. The screen displays the clinical question as the host narrates. The clinical question we're addressing is, in patients with established stable atherosclerotic disease, is Rivaroxaban+Aspirin more effective than aspirin alone in reducing cardiovascular death, stroke, or non-fatal myocardial infarction? The screen transitions to the bottom line as the host speaks. The bottom line, Rivaroxaban+Aspirin resulted in a modest 1.3% absolute risk reduction in cardiovascular death, stroke, or non-fatal myocardial infarction, with a trend toward improved mortality. However, this benefit comes with a 1.2% increased absolute risk of major bleeding. Visuals show key statistics and graphs as the host narrates. Even with effective secondary prevention strategies, patients with stable atherosclerotic disease still face a 5 to 10% annual risk of recurrent events. Past studies with warfarin and aspirin showed modestly improved outcomes, but at the cost of increased bleeding. The COMPASS trial, published in 2017, sought to determine if the newer anticoagulant Rivaroxaban could provide safer and more effective protection. The screen shows a schematic of the trial design. The COMPASS trial randomized 27,395 patients into 3 groups: Rivaroxaban+Aspirin, Rivaroxaban alone, and aspirin alone. The primary outcome was a composite of cardiovascular death, stroke, or non-fatal myocardial infarction. After a mean follow-up of 23 months, the trial was stopped early due to efficacy. Graphs and charts showing trial outcomes are displayed. The results showed a 1.3% absolute reduction in the primary outcome for Rivaroxaban+Aspirin compared to aspirin alone, with a 24% relative risk reduction. However, there was also a 1.2% increase in major bleeding, mainly gastrointestinal, but no significant difference in intracranial hemorrhage. A net clinical benefit analysis showed a 1.2% absolute reduction in overall adverse events for the Rivaroxaban+Aspirin group. The host stands beside a list of criticisms and mentions guidelines. The trial faced some criticisms, such as the exclusion of 2,320 participants during the run-in phase, potentially causing selection bias. The study was also terminated early, possibly overestimating benefits and underestimating bleeding risks. As of August 2017, no guidelines had incorporated the results of this trial. The screen highlights findings from subgroup analyses. A 2021 subgroup analysis showed that Rivaroxaban significantly reduced atherosclerotic cardiovascular disease and major limb events in patients with symptomatic lower extremity peripheral artery disease. This was further confirmed by the Voyager PAD trial in 2023. The host stands center screen with a call to action displayed. In summary, Rivaroxaban+Aspirin offers a modest benefit in reducing thrombotic events in stable atherosclerotic disease, but comes with increased bleeding risk. Decisions on using this combination should be made on a case-by-case basis. Don't forget to like, subscribe, and hit the bell for more updates on the latest in medical research. Thanks for watching. Background music fades out as the video ends.